Rates of opioid overdose have skyrocketed since the year 2000, including among kids and teenagers, and that has led a lot of pediatricians to cut back on their opioid prescribing. That left a lot of us worried that kids might not be getting adequate treatment for pain. Hi, I'm Dr. Scott Hadland, and I'm lead author of a new AAP clinical practice guideline on prescribing opioids in children. What we tried to do with this clinical practice guideline was to give good advice to pediatricians about how they can prescribe opioids safely and effectively when they're needed. One of the central recommendations from this guideline is that we want pediatricians to prescribe opioids when they're needed for severe acute pain in young people. But when they do so, they should make sure that they're using other non-opioid medications like acetaminophen and ibuprofen, as well as other non-medications, things like relaxation techniques, which can be really helpful in addressing pain and anxiety in young people. So when pediatricians prescribe opioids, they should prescribe them at the lowest effective dose of an opioid needed for the shortest amount of time possible. Often only 3 to 5 days are all that's necessary to effectively treat a young person's pain. One of our key recommendations is that every time a pediatrician prescribes an opioid, we want to make sure that they also prescribe a medication called naloxone. Naloxone is an opioid overdose reversal agent that can be sprayed up the nose and can save a life within minutes. We want to make sure that pediatricians talk to parents about how to recognize the signs of an opioid overdose, how to use naloxone, and make sure that they can save a life if someone gets into that medication and takes too much of it. And naloxone is critical not just for the teen or the child to whom an opioid has been prescribed, but they might have a younger sibling in the house who's at risk of an unintentional overdose if they get into that medication. And so it's really critical that pediatricians talk to parents and families about how to recognize the signs of an overdose and how to intervene with naloxone by spraying it up the nose to save a life. Another issue we sought to address with these guidelines was the undertreatment of pain in youth of color. Studies have shown us that there are big disparities according to race and ethnicity, whereby youth of color are less likely to receive effective pain treatment. Studies also show that other groups may be less likely to get effective pain treatment. This includes, for example, youth with disabilities or youth who have a history of addiction. We want to make sure that all youth get access to effective pain treatment when it's needed. The guideline also recommends that pediatricians talk to parents about how to use opioids safely, and one key measure is that parents should keep their opioids locked up. Another aspect is that pediatricians should help parents figure out how to dispose of extra unused medication after pain treatment is done. So pediatricians might consider offering medication drop-off in their own practices or helping families identify where in the community they can go to drop off their excess and unused medication. It's also critical that pediatricians talk to teens and their parents about how to recognize the signs of an opioid overdose. This includes somebody who might be starting to lose consciousness, or maybe they've lost consciousness altogether. Their breathing may have slowed down or stopped, and they might be starting to look pale or even blue around the lips. A final recommendation that we make in the guideline is for pediatricians to generally stop prescribing codeine and tramadol. Sometimes pediatricians prescribe these medications because they think that they're safer than other opioids, but actually studies show that these are medications that are associated with sudden loss of breathing and sudden death. So we really recommend that pediatricians stop prescribing codeine and tramadol. Treating pain can be daunting, but opioids are effective medications that can and should be used. These guidelines are really here to help pediatricians understand when and how to use opioids safely and effectively. Let's all work together to address pain in young people.